We're going to talk a little bit about the weather, right? And I'm going to explain why we do that when we get to a couple of slides. And then after that, Dr. Carvalho is going to spend a little bit of time talking about vaccines. I know there's a lot of discussion about flu shots and COVID shots and uptick in COVID and whatnot. So we're going to share a little bit of information about that and let you guys know how you can prepare for it so that we can all stay as healthy as we possibly can through the colder months. Okay, and at the end, we should have, I don't know, maybe 10 or 15 minutes just to deal with any questions that pop up. But as Marissa said, if you have any burning questions that kind of pop up, feel free to put them in the chat. And Marissa is going to be moderating the chat. And if there's a good question, it makes sense to ask it kind of mid-presentation, she will. All right, let's see the next slide, Carolina. All right, so we'll talk a little bit about the weather. As we said, we'll talk a little bit about flu vaccines and what we can do to stay healthy, and to talk about the value of getting ready for those weather changes so that we don't end up missing any of our exercise, because that, of course, is very important. Okay, next slide. Okay, remember, this is always kind of tricky, right? Because I know a lot of you know me, and a lot of you, I know Dr. Carvalho as well, and I'm familiar with a number of your background histories. But remember, this is a public session, and a lot of the information that we're going to be sharing with you guys is for general guidelines. Okay, I always like saying you should never, ever listen to some random guy on the internet about stuff. And for this particular session, consider me and Dr. Carvalho random guys and gals on the internet. So if you have any specific questions about your specific medical history and your care, your doctor is really the best person to ask. All right, but we'll provide some good information for you so that when you ask those questions, you can do so from a well-informed place. Right. So why talk about the weather in November? I mean, it's getting cold, but I think I might be able to get away with wearing my shorts on Saturday. I think they're calling for 13, 14 degrees, which is really perfect walking weather, right? Not too hot, not too cold. It's ideal. But everybody knows, like, winter is just around the corner, right? As they say in Game of Thrones, winter is coming. It will be here soon. And I'm also pretty sure that there's a handful of you guys that are snowbirds. I'm very jealous of you, but I know a number of you have probably got places down in Mexico, Florida, Arizona, and your solution to the cold winter weather is to go south where it's just not there anymore. So we're going to talk a little bit about the cold and a little bit about the heat, okay? Because I know you guys are going to be exposed to it varying degrees. So next slide. Okay, so our body is meant to operate at a pretty steady, even temperature. If it gets a little bit too hot, it gets a little bit too cold, it just doesn't work as well. The physiology isn't as efficient. So there's a number of systems that we have in place that are designed specifically to control that temperature very, very regularly. And I'm going to start off by talking about the systems that we typically will rely on in the warmer months. Okay, next slide, Carolina. So when it's warm out and we start to get a little bit toasty, there's really two mechanisms that our body use that will dissipate that excess heat that's building up. And I know we're very familiar with the first one, and that's perspiration. So covering a good percentage of our body are sweat glands. And when we start to warm up a little bit, we'll start to perspire. We'll basically put a layer of liquid sweat on our skin. And then what happens is the sweat evaporates. And if we all think back to our high school science classes, we think about a change of state, like how do we go from a liquid to a gas? We need some kind of energy. And in the case of sweating, it's heat energy that will take that liquid sweat and it'll form it into a gas. And that heat energy, when we take that to make the change, actually lowers your body temperature, right? So perspiration is a very, very good way of getting rid of excess heat, right? It does have some consequences. A lot of the fluid that we lose in sweat actually comes from our blood volume. All right. So as we lose fluid, it's important that we replace it. Otherwise, our blood volume will drop, which does have a few consequences. Heart rate will go up, blood pressure will go down. You'll start feeling fatigued. It's just not a good thing, but it's easy to avoid just by hydrating. Okay. The other mechanism that we have is just simple radiation, right? Generally speaking, our body is warmer than the surrounding environment. So when we get a little bit warm, the simple fix is just send that warm blood away from the core of the body out to the periphery, out to the skin, and you'll just radiate heat through the skin into the air, which is a little bit colder. I mean, I've got a couple of kids and they're older now, but I remember when they were young, when they had a high fever, just putting my hands in front of their face, I could feel the heat radiating off of them that way. And that's a fairly effective way to get rid of heat as well. Okay, so those are the two main systems that we'll use to get rid of excess heat. Let's look at the next slide, Carolina. Okay, like all systems, they work pretty good, but they can be overwhelmed. All right. And when our systems get overwhelmed, um, we start to overheat, and there are consequences to that. So this is a graphic that came across my desk off my BBC News feed this summer when they were just like having really crazy hot temperatures in the UK. And what they did, it was an interesting experiment. So the BBC health reporter went into an environmental lab, and basically they had a climate-controlled room. So they could set the temperature, humidity, and all this kind of stuff to whatever they want. And what he did is very simply, shorts and t-shirt, just like he's wearing right now, he sat on a chair. They put an ECG on him. They measured how fast he was breathing, checked his blood pressure. They measured all these physiological responses at a temperature of 20 degrees Celsius, fairly comfortable. And then they just started turning up the heat, turn it up a little bit at a time until after 1 hour, they had increased the temperature to 41 degrees. And I think at the time, that was the temperature that they were dealing with in the UK. All right. And then they measured and they found some interesting things. All right. So I said that one of the ways that we get rid of excess heat is through sweating, through perspiration. And sure enough, this health reporter sweat. All right. He lost almost half a liter of fluid in 1 hour. And guys, that was just sitting still on a chair, not doing anything, just sitting perfectly still. Okay. I said that a lot of the fluid we lose in perspiration comes from your blood volume. As your blood volume drops, the amount of blood that's left needs to get circulated quicker. What circulates your blood volume? Your heart. So if you take a look, you'll see his heart rate increase from 54 beats per minute at rest up to 87. And once again, he's sitting still. He's not doing anything. His heart rate went up 30 beats per minute, simply because the temperature was going up and his ability to dissipate the heat was becoming overwhelmed. Okay. You can see that he's being overwhelmed when you look at his core body temperature. Starts off at 36 degrees, goes up to 37.5, right? So his ability to regulate is starting to go away. On top of losing heat through the sweating, you can see he's also trying to lose heat through radiation. And I said radiation refers to your body sending all that warm blood from the core of the body to the periphery. And if you look at his skin temperature, from 31 degrees up to 35. That's a perfect example of sending all that warm blood away from the core out to the periphery to try and radiate it into the air that's out there. Okay. His rate of respiration went up, so he's under a little bit of stress dealing with the heat. And it affected him cognitively as well. And this is an interesting one, right? You guys know I'm an exercise guy. I'm typically focusing on the heart, but I thought it was pretty interesting to see that the blood flow to his brain fell like almost 9%. 8.5% is pretty significant, and it affected him cognitively. They had him do some memory puzzle scores at the start of the experiment, and then 1 hour later, when the temperature went up, and you can see a score drop from 23 over 30 to 17 over 30. So it really does affect you physiologically when those systems start to overwhelm you. Okay, let's look at the next slide, Carolina. So does it matter? So I'm sweating a little bit more. So I get a little dehydrated. My heart rate's up a little bit. Does it matter? We all know the answer to that, right? Every single year during the summer, you see the news is just covered in people that are dying from heat deaths. All right, we had that big hot spell out in the west coast of Canada and BC a little while ago, and there were tons of people that died. Their ability to dissipate the extra heat went away, their physiology stopped working, and the end result of that is death. Right. So this was an interesting study because everyone's talking about global warming, and they're talking about all these severe extreme weather events are going to become more and more frequent. This was an interesting one who's suggesting that in BC, almost 1,500 people are going to die every summer just because of the extreme heat. Right in 2030, that's what, 7 years away. That's not too far. All right, so it is a significant issue. If you overheat and you can't get your core temperature down, it can be fatal. Okay, let's look at the next slide. So How can I avoid becoming a statistic? That's everybody wants to know, right? What's in it for me? So there's a number of things that you can do, and this is a tool that I hope everyone has access to. If you don't, if you go to our website, cardiaccollege.ca, and look up hot weather or search for heat safety index, you'll see this slide. And we really like using this slide here at the center because it's a tool that lets you determine how much heat stress is placed on your body at any one time of day. All right, it's very simple to use. You just need to know what's the humidity, and that's on the vertical axis, and then what's the temperature, and then you just draw two straight lines and see what zone they cross in. So if it's 25 degrees and 40% humidity, that falls into the safe zone. If it's 32 degrees and 70% humidity, that falls into the danger zone. Okay. And then, yep, next slide, Carolina, that's good. Once you know what zone you're in, you should look to modify your exercise accordingly. So in the safe zone, the heat stress is pretty low, guys. Most people should be able to exercise as usual, and you don't have to really modify your exercise at all. Heat stress is pretty mild. In the alert zone, your heart is going to be doing more work. You know, the heart rate's going to be up, and you need to offset that. So decrease your exercise intensity. So go a little bit slower. And if you really find that, boy, it's hot, I'm really feeling it with my exercise, prudence is the better part of valor. Cut your exercise duration down as well. Okay. But as long as you're smart and you pay extra attention to your heart rate and how you're feeling, you can still get an exercise session in the alert zone. Okay. Once we get into the danger zone, we usually encourage people not to do their exercise in the danger zone. All right. Your body's going to be working fairly hard to dissipate the extra heat. And everybody knows that exercise generates heat as well. So if it's already pretty hot out, trying to exercise and generate more heat, it's just a recipe for disaster. So in the danger zone, don't exercise outdoors. Okay. Find a place that's inside or just take that day as a rest day. All right. And every summer we have a few days where we get into the emergency zone. And I'll tell you why this is such a big deal. In the emergency zone, it's when the city opens up all the cooling shelters. All right. And the reason for that is in the emergency zone, our ability to get rid of heat is almost completely negated. So one of the things that you'll find commonly is when the city declares a heat emergency, the humidity is often quite high. Remember that sweating is an effective way to get rid of body heat, but that only happens if the sweat evaporates. If there's a lot of humidity in the air already, your sweat doesn't evaporate. It just drips off of you. If it's dripping off of you, it's not cooling you down, and you lose that ability of sweat to get rid of the excess heat, which is dangerous. And the other thing in the emergency zone, the relative temperature is getting to the same level as your body temperature. Radiating heat out of your body only works if the air is colder than you are. If the air is warmer than you, you're going to start absorbing heat. All right. So both of those will often be seen in the emergency zone, and it's very, very dangerous because it negates your ability to get rid of heat. That's why it's such a big deal. Okay. Let's look at the next slide, Carolina. There's a few other things that you can do to help as well. All right. So hydration is a big one. We lose so much fluid through sweating. You saw in that experiment, just sitting still in 1 hour, the health reporter lost almost half a liter. So it's important that you hydrate. A good rule of thumb that I like to share with people is 6 to 8 ounces of water before you do your exercise, and then another 6 to 8 ounces for every 20 minutes that you're out there. Okay. The only little caveat that I'll put on there, the little star exclamation mark, is if you're on a fluid restriction. All right. Some of our heart function patients are told don't drink more than 1.5 liters. That's the case. You really need to follow the advice that was given you by your physician. Don't increase your fluid intake. Stick with your restriction. All right. Watch for symptoms. We know that hot weather has a significant stress on the heart. And if you're feeling it, acknowledge that your heart's having a hard time and help your heart out. Slow down. Don't go as long, or even just take the day off. Okay, dress for hot weather. So the two things to keep in mind with hot weather is number one, um, sweat needs to evaporate to cool you down. So like all that spandex that you see all the kids wearing, it's the worst thing in the world. Because if you got spandex, there's no airflow. If there's no airflow, the sweat's not going to evaporate. So loose, airy clothing makes it far easier for the sweat to evaporate, and that's going to be more effective cooling you down, right? So nice, loose, baggy clothing is important, and also lighter colors. All right. If anybody's got a black interior in their car and you leave it out in the hot sun in August, you know you touch that thing and oh boy, it's hot. Dark colors absorb heat. So wear light colored clothing, it reflects the heat and it just keeps you a little bit cooler. Okay. And this is a big one for you snowbirds because a lot of people will be going from cooler weather to all of a sudden it's like 30, 40 degrees warmer than what you're used to. Give your body a little bit of time to get used to the hot weather. Okay, it'll make some small changes. Something as simple as you'll actually start retaining more fluid in the warmer weather, so your ability to sweat is a little bit better. And you guys know this. Like in July, August, you get people saying, "Oh, my rings are a little bit tight on your fingers." That's an adaptation to the warmer weather, just retaining a little bit more fluid, so it's more available to sweat. Okay, so give yourself a week, week and a half or so to get used to that hot weather. Especially if you're going down to Mexico. Don't feel you need to exercise that first day there. Take it easier for a few days just to get used to the heat. Be careful with alcohol. Oops, sorry, go back, Carolina. Be careful with alcohol. Alcohol is a diuretic, right? So that'll just increase the odds that you're going to be losing more fluids, right? And as my previous slides showed, if there's a lot of heat stress out there, help your body out by slowing down. Okay. So that's a little bit about hot weather. Let's switch gears to our next slide and move into cold weather. All right. And unfortunately, for most of us, I think, us poor schmucks that are not going to get to go to Mexico for the winter, we're going to have to deal with the cold. All right. And every year in Canada, it's there. The main mechanism that our body uses to try and retain heat in the colder weather is vasoconstriction. Right. And basically, all that means is it's the opposite of the hot weather. In the hot weather, we want to send warm blood away from the core of the body so we can dissipate heat. In the winter, it's the opposite. We want to keep all that blood in the core of the body. There's more tissue here, so it's a lot easier to retain your heat. Right. And we all know that if you have a pipe that's this big and I start to constrict it, make it smaller, it's a blood vessel that gets smaller, your blood pressure is going to go up. All right, so that's the main cardiac consequence of colder weather. Your blood pressure does increase. All right, and as I said, muscles generate heat. That's a problem in the summer when you're trying to avoid it. In the winter, moving is a good way to stay warm. Okay, so let's look at the next slide, Carolina. All right, so as I said, the big issue that we have in the cold weather is that your blood pressure does go up. This was an interesting abstract that just came out not too long ago from the American Heart Association, where they took a look at 60,000 Americans that were living in the northern part of the states and dealing with cold weather through the winter months. And what they found is that generally speaking, their blood pressure ended up being elevated. And about 5% of people they calculated their blood pressure control was suboptimal in the winter months. And that's just because it's colder. And one of the consequences of colder temperatures, your blood pressure starts going up, right? Number one risk factor for stroke, poorly controlled blood pressure, right? So it is a little bit of an issue. Next slide. Okay. Is it a big deal? Yeah, it is. There's so many people who die every year because of the hot weather. There's more people who die because of the cold weather every year, right? And that's what this study was taking a look at. A little bit old, 2015, but 20 times more deaths in Canada, these other 13 Nordic countries compared to hot weather. Okay, so it is a problem. It can be fatal. So let's look at the next slide. What can we do to cope with the cold weather? All right. I guess I always like to tell people, and I've done this cold weather talk at work here a couple of times in the last couple of weeks. You can sum this whole thing up by saying, just don't get cold. Because if you don't get cold, your body doesn't need to do all these things to retain its heat. Everything works really, really well. So as long as you're at a comfortable temperature, you can avoid a lot of these blood pressure increases. And the best way, of course, to avoid getting cold is to make sure you wear the right clothing. All right, so the couple of things to keep in mind with right clothing. Try not to wear cotton up against your skin in the winter. And that surprises a lot of people. And I know I'm a bad offender of this myself. I tend to have a lot of cotton clothing. But the problem with cotton is when it gets damp, like when you're perspiring, cotton stays wet for a really long period of time. And if you've got this wet cotton material up against your skin, it wicks the heat away from you very, very quickly. All right. So if you can stay dry, you're far more likely to stay warm. Okay. So alternatives to cottons, there's a number of them out there. The shirt I'm wearing right now is one of these dry weave golf shirts. All right. So these dry weave materials are great. They won't get all damp and stick to your body. Silk is another good dry natural it's another good naturally occurring dry material, right? So silk is fantastic. Wool works too. But I like wool up against the skin. Just I shudder at that thought, right? It's not comfortable. But try not to wear cotton, especially on your feet. I know a lot of people sweaty feet. We never like to admit it, but a lot of us have got sweaty feet. And if you're wearing cotton socks, which most of us do, those sweaty feet in the cotton socks stay wet for a long period of time. And I know a lot of my patients in the winter complain about cold hands and feet. A really good option is they make really nice dry weave socks. You can get them in sporting stores, probably Walmart, Costco, that kind of stuff. They tend to be quite thin though. So what a lot of the staff here will do is they'll wear a dry weave sock and then they'll wear a wool sock over top of it, right? And that's a good way to keep your feet warm. Okay. Understand in the winter that the weather can change very, very quickly. You can go out on a fairly nice, comfortable 2-degree day, but once the sun dips down below the horizon, temperature can fall as much as 7 degrees quite quickly. A little bit of wind picks up, and you can get very, very cold, very uncomfortable, very, very quickly. So be aware of that. Be careful of snow and ice. I can't tell you how many of my patients have had bad falls because of icy weather. So be very thoughtful of that. I know I've gone out and I've got some cleats that I just put over top of my running shoes or my boots, whatever I happen to be wearing. It's almost like little golf cleats that you can put on. When I walk my dog in the back where it's icy, I put those things on. I've had too many near bad falls where I hurt my back. They're lifesavers. Okay. Know your limits. Typically we say once you get to minus 10 degrees Celsius, no matter what you're wearing, it's going to be pretty hard to stay warm. So that's usually the cutoff that we have. Marissa, I see a question.
There's a question that came in about temperature, talking about the feels like with cold weather.
Good
And
question.
yep, if you
Yeah,
could just go
yeah.
through that.
So it's kind of the bottom line that we're looking for, right? And that's really what feels like temperatures are. So, I say the cutoff is about minus 10 degrees. So if it's -5, but it feels like -15, you want to go with the feels like temperature. So -5 might be reasonable. Feels like -15 is probably too cold because there's a lot of factors that all contribute to what the temperature will do to your body. And it's really that composite, the bottom line that we want to go by. So in the winter, feels like is the temperature you want to go by, and also in the summer, when it's 20 and it feels like 32, you really want to go with the 32 because that's going to impact on the physiological effect the temperature has on your body. So feels like is the number you want to go with. Okay, good question. Okay, so I just want to talk a little bit about snow shoveling before I turn things over to Carolina. All right, so next slide, Carolina. I don't think we see this too much in Toronto anymore, thank God. Um, but we often will have to deal with snow shoveling. So what's the deal with snow shoveling? Let's look at the next slide. Snow shoveling combines a number of characteristics that results in really, really bad graphs like this one. Okay, so let me kind of set up the scene and then I'll explain my graph here. Picture this. You get some snowfall and you're thinking, okay, I got to go out there. I'm just going to shovel the walk and I clear off the car so I can get out there. Um, how many people out there, if they're going to do that, would think, yeah, I'm going to do a warm up first. I'm going to walk around the house for a little bit and get warmed up. Because I guarantee every one of you that's been a patient here in the program has been told, always do a cardiovascular warm up. Build into your exercise. This allows your coronary arteries to dilate, to maximize the flow of oxygen-rich blood to the heart muscle, so it moves and pumps most efficiently, and it minimizes the risk of your electrical system misfiring. And I've said this a million times if I've said it once. I pretty much guarantee nobody does that before they snow shovel. Nobody warms up. Okay, so that's a problem. The other thing is, how many times do you say, well, I'm just going to go shovel, clear off the car. I'm only out there for 2 minutes. I don't need to wear the right clothing, right? We just said that if you wear the right clothing, you can mitigate a lot of that feeling cold and keep your blood pressure at a reasonable level. If you're not wearing the right clothing, you're going to go out and your blood pressure is going to go higher as well, right? And that's going to put a big stress on the hearts. Okay. Um, and also, if it's snowing, it's going to be cold as well. So that's a double dip on the blood pressure, right? So a lot of people do that, and snow shoveling can be very physically demanding. Right now, it depends on the size of the shovel. It depends if it's wet snow, dry snow, if it's all the stuff the snowplow puts in front of the end of the street. But it can require the same amount of energy as doing a 6 minute mile. And I don't think I've worked with anybody in my 30-year career who can handle a 6 minute mile, maybe one person, maybe. So it can be very physically demanding. And you put all that stuff together, and if someone ever comes up to you and says, "Hey, what do you think is the day of the year where more people are in the hospital in Toronto with chest pain than any other day of the year?" If you're a gambling person, you want to say after the first snowfall of the year, because it just creates a really bad environment. So this is an interesting study that was done in Ottawa back in 2017. And really, I think the big thing that I want to point out is that first kind of graph in the upper left, hospital admissions of men based on snowfall. And you can see there's three lines kind of driving up. You want to focus on the one in the middle. Um, that's how much more likely someone was to have hospital admission with chest pain because of the snowfall. Okay. And the one beside that is how much more likely is somebody to die with shoveling snow, right? Those numbers go up very, very steeply. And that's based on how much snow fell. All right. Interestingly, and I don't know why I need to take a closer look at this, the two squares beneath it are for the women. And it seemed like women were a lot less likely to end up in the hospital after shoveling snow. And they were a lot less likely to die after shoveling snow. I don't know if that means that they just don't shovel as much, or guys use bigger shovels. We push harder and we're just not smart about our symptoms. I think that's probably the latter thing. Okay. And duration of snowfall doesn't have as big an impact. When you get those snowfalls where you get a little bit of snow, but it falls over like half a day or a day, it's just a little bit easier to clear the snow. And you can see that less people in the hospital, but there's still an increase. And same with death as well. Right. So snow shoveling is very, very dangerous, high risk activity. I know that sometimes people say, but Rob, I've got to go out there and do some stuff so I can get the car out, so I can get the kids out, so I can get myself out. I always tell people if you're going to do that, the number one most important thing to realize is lots of people die shoveling snow. All right. So it's very, very, very high risk. You need to approach it very cautiously. You need to make sure that you warm up properly. All right. Do allow your coronary arteries to dilate so the heart muscle gets all the oxygen rich blood that it needs and it moves well. Very, very important. Okay. And dress for it. It's much better to be warm and then just kind of lower down some zippers so you can cool down than it is to be cold, because then your blood pressure is going to spike up and you're about to do a very physically demanding activity, which is going to increase your blood pressure even more. So be very, very careful with it because it is high risk. This is one of those activities where the cardiologists usually say don't shovel snow. I tend to agree with them. Okay. And one thing I will say, I do have this nifty little service I've always got to share with people. If everyone's curious if they're shoveling snow properly, I offer a free complimentary service where you can come to my house and shovel my driveway, and I will monitor you to make sure you're doing it properly. Marissa, you have a question.
I was waiting for you to say that, Rob. I know.
If you want to volunteer, Marissa,
No,
you're more
thank
than
you.
welcome.
Okay, question came in. This person is an avid skier, always out in the cold in the winter. They wear layers, good outdoor clothing with no cotton, and they have heaters in their ski boots. What are
Hmm.
your thoughts on heated vests that are battery powered?
Yeah, so I mean, the technology has just gotten so good with that, right? Heated socks, heated gloves, heated boots, heated vests, all that stuff is fantastic. I'm a huge fan. I mean, I said you can simplify, you can summarize all this stuff with cold weather just by saying don't get cold. So if you have anything that you can wear that's going to keep you at a good, comfortable body temperature, you can mitigate that blood pressure increase. And guys, that's what it's all about. So absolutely, heated vests, definitely. I'd have no problem with that. I would encourage it for sure, and not just for skiing. I mean, there's some people that really hate the winter because it's cold and they're miserable. If you've got clothing that results in you being cold, yeah, you're going to be miserable. Invest in some decent clothing. Buy those battery-powered socks. Buy those battery-powered gloves. So then when you go outside, you're warm. It's a lot safer. And I mean, like we're going to have to deal with snow for a couple of months. If you're comfortable, it's a lot more enjoyable. So definitely worth it. Okay, I think I got one more slide, Carolina, which probably doesn't say much of anything. Plan ahead. So this is just kind of the big one, right? You guys know that the cold weather, and if you're going down south, you want to see warm weather. You know that it's coming. All right. So really kind of plan ahead for it because the last thing you want to do is there's a snowfall and it's like, oh, where am I going to do my exercise? When am I going to? I can't get my exercise in. You know that it's coming. So put some thought into planning where you can exercise when the snow falls, what you're going to do when the snow falls. When you go down south, what can you do to offset the heat? Because that way you're not going to miss your exercise. Remember, guys, that's what it's all about. You got to keep exercising regularly. Okay. I think on that note, I've rambled long enough. Carolina, I'm going to flip it over to you. Um, Marissa, do you want to do an introduction for Dr. Carvalho?
I sure can.
All yours.
Um, all right. We've had the fortunate opportunity to have Dr. Carvalho speak here before at another talk previously this year. So thank you again, Dr. Carvalho, for spending the time with us. So Dr. Carvalho is going to talk a little bit about seasonal changes in health. She has been with us for a while now and is a wealth of knowledge. We're really lucky to have her. So without further ado, I'll pass it to you.
Thank you, Marissa. Thank you for your kind words. And it's my pleasure to be here. I've been in the program for 4 years, and I don't know if I saw you, those who are listening, but I'm curious and leave a message and make your questions, put your questions in the Q&A during my talk. So today, we will start off thanking Rob for the introduction and the amazing talk. He has already provided a lot of information and facilitated my job. Thank you, Rob. So because we are about to start the winter, I will focus on winter. And there are some things that usually we do more often in winter. So we usually spend more time indoors. It can promote sedentary habits. So these two by itself can increase the dangers of this winter season. Also because it lower resistance to contagious disease if we are not doing as much exercise as we used to do. If we are together close in a small place, it can also promote the spread of germs more easily. For some people, if the weather is too cold or just cold, it can also exacerbate respiratory and cardiovascular symptoms. And when we have snow or we had snow, we may have more slippery surfaces, and it will also increase the risk of falls. Falls are dangerous. And it's not because we may break bones, but also because some people will hit the head on the floor. And at the end of the day, some people die because of that. So actually, it's a big cause of death. So there are many reasons why we need to be aware of the winter and to take all the precautions to be healthier and safer, okay? So let's start off with our checklist that I suggest you to think about during the winter. So first things first, we will talk about vaccines. So as I said, we tend to be crowded in some places, sometimes commuting, sometimes traveling, and sometimes indoors. So we may receive visits or not. We may go to friends or someone else's house, and we'll be together sharing viruses, bacteria, and other germs. So this is one of the good reasons when we need to think about getting our vaccines. And I will really raise your attention to the flu vaccine. It's definitely the time to think about taking it. As we know, the flu vaccine prevents flu and also its complications. And I'm talking about pneumonia, for example, and even dying because of that. Can also prevent the spread of the virus to other people. Can also, and also it can prevent the spread of the virus, even if you don't really have symptoms, but you got the flu virus in your body. Because of the changes in influenza virus, so there are many strains, they keep changing during the time. And that's why it's recommended for us to take the most updated one. So that's why we need to take one shot every year, because it will have the strains that are circulating in that year. And important to mention, the earlier we get the flu shot, the greater will be our protection throughout the winter. Why? Because after the vaccine, our body will have time to create the antibodies, to really strengthen all the protection. It's not only antibodies. And then when the time comes and we get more exposed to the flu virus, then we will be able to be protected and responding better to that virus attack, and hopefully more effectively, okay? So this is one of the key messages that I have today. And why it's important, especially for those who have or had a cardiac condition or a cardiovascular condition. So we know that every time we have an infection, especially flu and also COVID, it triggers a lot of things in our body. For example, inflammation. So there is a very interesting study that was published just a few months ago, and it analyzed people who got the influenza vaccination and those who didn't get the vaccine. So as I was saying, if people have the influenza, it may trigger what we call inflammation, and also a lot of other answers. And inflammation is not good for our arteries, especially if we already have blockages or what we call also coronary artery disease. And what may happen? So if someone has a plaque in the heart, in the coronary arteries that brings blood to the heart, that plaque may have a rupture. And if there is a rupture, a lot of other cells will come and there will be a clot building up in this artery. And it means that that person could be having an angina or unstable angina or even a heart attack. So yes, the virus can increase the risk of a heart attack, and this is one of the reasons. And if a person has a heart attack, unfortunately, that person will also be at a higher risk of dying because of that. So this study analyzed thousands of patients and showed that those who were receiving the most updated influenza vaccination had lower cardiovascular events. And it has been consistent over the years. So it's not only in 2023, but also along the maybe decades that we know that taking our flu shots can help us to decrease cardiovascular events. So it's also usually a concern, okay, but I have a problem in my heart, should I really take it? So the benefit is even greater for those who already have a cardiac condition. And we can talk more about that later if you want. So for the COVID vaccine, the idea is very similar, that we wanted to decrease the response, the inflammatory response, because we know that COVID infection can also trigger cardiovascular events. And I mean here heart attack and also stroke, just to mention a few things that COVID infection can cause. So we know nowadays that the COVID vaccine can prevent COVID infection and its complications. So also pneumonia and other things like long COVID. We know that the vaccine, if less people have COVID infection, it will lead to a lower spread of COVID to other people. Likewise, like the flu vaccine, if we know that the virus, the COVID-19 virus has changed along the years, so it's another reason for taking the most updated vaccine. And then when we look at the just released suggestion or recommendation from the NACI group in Canada, so they recommend vaccination with a COVID-19 XBB formulation this fall, which better protects against the new Omicron XBB variant, okay? So that's what is suggested and recommended. And the recommendation is also for people to take it after 6 months after the last dose of the COVID vaccine. Let's say you took one 3 months ago, so you should wait a little bit for the next dose. And also to wait for 6 months if you had COVID recently. So they recommend also to have the vaccine early this fall, if possible, for the same reason. So we give some time to our body to build up more protection before the winter really comes, when we know that we'll be more indoors and everything else that I said earlier, okay? And the big question that always comes is it safe to take the COVID vaccine and the flu shot at the same day? And the answer is yes, definitely, okay? Okay. So sometimes we have many questions about the vaccine. We don't feel safe. We want to take to someone else. And even sometimes people want to find someone who speaks the same language. So maybe cultural resonance, alignment. So it's amazing that Ontario has a line, has a way that you can access this website, ontario.ca/book vaccine, as you can see here in the bottom, and you can book your vaccine with someone who speaks the same language that you do. So this is interesting. And if you want more information, also the website this website from Ontario is really great. So I suggest you to take a look at that. There are contraindications like allergies and other conditions, although it's very, very rare. And if you have questions, definitely talk to your healthcare provider to have an individualized assessment and advice. Okay, since we are here, it's important to mention that vaccines, generally speaking, should be updated. And I call your attention for the tetanus and diphtheria vaccine that we should take every 10 years. For those adults older than 65, also the Ontario Health recommends the pneumococcal polysaccharide vaccine to prevent pneumonia and meningitis caused by this bacteria. Okay, so important to mention. We know that pneumonia is more frequent during the winter, so consider having this if you qualify. And also shingles vaccine. Shingles, for those who don't know, it's also called herpes zoster. So also for those between 65 to 7 years of age, it's also recommended as something to prevent shingles and its complications. Okay, great. So,
Marlene, sorry.
Oh yeah, go ahead, Marisa.
A question about COVID and the flu vaccine and getting it at the same time, asking in regards to a recent FDA study about there being a very low risk of stroke from getting them at the same time. Wanting to know your comments on that.
Thank you so much for the question. Yes, so there have been a lot of studies showing that it's safe, exactly, that the risk of having adverse events or effects such as stroke or even lower efficacy of one of the vaccines, it has not been shown. So there are no concerns regarding stroke and other possible events. So it's safe. and it's the recommendation not only for from our government, but also from a lot of papers. I just got one paper talking about that. That's safe, which has been assessed around the world, not only in Canada and in the US.
Great, thank you. There's one more question asking about the RSV vaccine, and is it recommended for cardiac patients?
Oh, good question. So I will be very honest with you. I don't know the details. And so I've heard about the vaccine. And what I know is that there are no contraindications for that vaccine in the population with heart disease. Okay. The criteria to take this vaccine, I'm not familiar with. So please talk to your healthcare provider. I can also take a look at that later and answer this question offline. Happy to do so. And but we can think that if we are talking about decreasing the risk of a respiratory infection, for all the reasons that I have already alluded to, I think it could be a nice approach, but I will take that offline, okay? Okay.
Great, thank you.
No problems. So important reminders. I know it sounds a little bit, oh, that again? Yes, that again. So it is still important to say that we should wash our hands frequently with soap or at water, or if not possible, at least using a hand sanitizer. So let's say you are in a restaurant and you were at the subway and you are going to deal with your food, you're using your hands. So consider cleaning your hands first, right? And it doesn't mean that we should do that only during the winter, but I would say always. It's very polite when I see that people are coughing and sneezing into their elbows, not using the hands. Why? Because later we will touch everywhere. And then if someone else comes, so the spread of the virus could be easier, okay? Not only the virus, but bacteria and other things. And important to mention, stay at home if you're not feeling well, okay? We never know, let's say, no, I will just pick up something in a restaurant or just going to, I don't know, go and do something in the streets. Think that we don't know who who the folks we are going to meet are. Maybe there are people also with heart disease, or people who have someone at home who have heart disease. So let's think as a community, not only individually, that we can help others with our simple actions, okay? It's an invitation. So coming back to our winter checklist, and thank you, Rob, for all the amazing introduction and probably all the work that I would have now. It's important to mention some things. So avoid lengthy exposure to cold, wind, and wet weather, okay? Watch out for signs of frostbite. So especially those individuals who have Raynaud's, it's a condition where the circulation in the extremities is not so well, it's not so good, and it may increase the risk of the frostbites. And also those with diabetes or other reasons for what we call neuropathies. So we may not feel, but it's possible that there is like injury because of the winter or because of the cold. So extra cautions is very important for those who cannot feel very well the extremities, both hands and feet, okay? And remember, just a few minutes, if it's -30, may be enough for someone to have a frostbite, okay? So stay well hydrated. And as Rob said, if you have a water restriction, follow the advice from your healthcare provider. Otherwise, try to keep yourself well hydrated. Dressing cold is number 5 in my winter checklist. on my winter checklist. And Robert has already alluded to most of the advice that I was going to give. I would say we know that nowadays there are so many difficulties sometimes to buy new clothes, brand new clothes. So consider buying a second-hand clothes, especially if it's for children. Maybe you can save a lot of money, okay? Or if you have something that you're not using, you can also donate. I will call your attention for number 6. So avoid slips, trips, and falls. So wear the right shoes, as Rob was saying. And there are many situations where there is a higher risk of having a fall. And if you don't know exactly if the shoes that you have is or are the best for avoiding a fall, I invite you to take a look at this website or just Google Rate My Treads, Kite UHN. So what this group did. So they have a winter lab. You can see that on the left panel. And they can reproduce slippery, icy conditions. And then there is someone here monitoring everything, measuring everything in terms of balance, about stability, and other things. And then the person will be there, or in this case, they performed a lot of studies with different boots that we have available in our market in Canada. And they checked if they were delivering what they were promising in terms of not slippery or even, I think, waterproof, and a lot of other details that I don't remember. So if you wanted to take a look at that website, you can maybe find your boots. And if you're planning to buy something new, you can take a look at that website and see which ones were on the top of the rates, okay? So something else that I will call your attention that it's a common problem and that sometimes it's underappreciated. So we have also frequently skin that is very dry during the winter. So obviously it's important to cover up. It doesn't matter if you're men, women, or if you're non-binary or something else, no problems. Everybody should wear or try to use a moisturizer every day. Why? Because skin, it will be drier and drier if we don't hydrate our skin. I know that some people say, no, it's too sticky, I don't want to do that. The same for wearing a sunscreen. So if you go and you explore your local pharmacy, you will see that there are many options, including those who are very liquid, who are extra fluid, and they are really non-sticky, so very comfortable to be used. And I really recommend you to take a look at that, okay? And I would like to call your attention, if it's the case, even consider using a humidifier at home. Okay, so how do I know if my house air is dry? So usually we'll realize that because of the increased static electricity. It's typical in children to have the hair like this, or you have, when you touch someone else, there is that little shock, especially if you have carpet at home. And sometimes for those who have pets, you may feel that when you are petting your loved one, there are really shocks and all that sometimes sound coming from just trying to touch your pet, okay? So talking now about health. So some of you may have experienced frequent nosebleeds, dry skin, chapped lips, and dry throat and nose. Okay, so all of these, sometimes it's coming just because our house is too dry. The air in our house is too dry. And what is the problem? If it's too dry, think that the air coming into our nose or our mouth, it's going to the lungs, and it's going to the lungs really, really dry. So it's not that pleasant for our body to breathe that air that's too dry. So in some people, you may have more respiratory infections, allergies, and other things like this. So considering measuring also the humidity with a digital hygrometer, if possible. So I just, out of curiosity, I Googled today, and there are some in the market for $10 or more if you want something more sophisticated. And also check the weather forecast. So if you Google weather forecast, and you can see the information, at least outside, you have an idea of how dry is the weather, okay? Of course, at home, it will be different, especially if you have a heating system, could be a fireplace or even the air conditioner. We know it may also decrease the humidity in the air, okay? Okay, so what would be the benefits from having a home humidifier? So it will add moisture to the air that is decreased in cold weather. It helps to alleviate dry nose, throat, and skin. Also helps to alleviate runny nose, allergy, and asthma. And I would just remind you that if you decide to have one, just try to use filtered water, okay, to prevent dirties, such as sometimes germs or other minerals to come into your humidifier. Keep the humidifier filter clean or replace it as needed. And check the humidity level. So again, if it's possible, have a hygrometer. If it's not possible, okay. The suggestion is to have the humidity between 30 and 50%, okay? Lower than 20, usually it's really dry, okay? So at least higher than 20 would be a good idea, okay? Something else that can indefinitely impact our health is carbon monoxide and poisoning. So it's very dangerous, as you know. And that's why it's so important to install a carbon monoxide detector at home. Don't forget to check the batteries at least once or twice a year. And there are other things that we can do as well. So open the garage door before starting your car, especially during the winter. We may, no, I don't want to do that. But no, it's very important. Keep your furnace and other fuel burning appliances properly vented and serviced. So for example, water heaters, cooking ranges, fireplaces, space heaters, etc. Okay, we need to circulate the air so that carbon monoxide can go away. And that's it. So remember, so carbon monoxide, we cannot see it, we cannot smell it, and we cannot taste it. So really important to have awareness of that, okay? Number 10, the last one, have a plan to be prepared, as Rob highlighted. So for example, when you are traveling or commuting, consider having an emergency supply with you, so emergency supplies, and warm clothing in case you become stranded. So online, you can even see, okay, what emergency supplies mean. So there are lists that you can think what applies to you and you can have in your bag or in your car. If you will be in remote areas, tell others your route and expected return date. Okay, that's very important as well. And finally, our last request for you, reflect on your next steps. So winter is coming. What are you going to do today or tomorrow or next week after this conversation today? And I would finish also sharing some resources with you. So for those who are familiar, you can access cardiaccollege.ca. For those who are not familiar, we have a session here that says virtual online, virtual, oh, cannot hear from here, it's okay. So you can find many videos in that, on that left side screen or session. And then you will find the videos that Robert mentioned about not only cold weather, hot weather, and the table with that graphic that he mentioned. I also invite you to take a look at the new Cardiac College for Women website. It's also under this main website, Cardiac College, and you can find information dedicated to women's cardiac health. And finally, the last slide, you can also access our website called diabetescollege.ca and explore online tools, including also how to exercise in the hot water if you have diabetes. So I think we have already covered all of this, and without further ado, I would like to thank you so much for listening, and let's open to the Q&A.
Okay, I think a lot of them we've been answering as we go, Rob and I, and so the one question we haven't looked at yet, can you discuss COVID shots and the heart?
Yes, so did I stop sharing? So just...
We still have the Q&A slide up.
Okay. Okay, so we can... Okay. I think now it's gone.
Yep, you're good.
Okay, so COVID shot. So the question is, what would be the benefits of taking the COVID vaccine in terms of cardiac health, right? So risks and benefits. Let's start with the benefits. So we know from different studies that the COVID infection can increase the risk of inflammation, will increase inflammation, and it can trigger bad things to happen, including that eruption in the coronary plaque that I mentioned, okay? So far, we don't have a dedicated study showing the benefit. It was not designed for that, but we have many other studies showing that among those who took the COVID shot, the risk of having a cardiac event, heart disease, or even stroke, and even dying because of that was lower compared to those people who did not take the COVID shot. Okay, so that's why we suggest that people should consider taking it. Okay. Risks, that is common, a frequent question, although I have not seen any questions coming from that side. So at the beginning, there was a concern about something called pericarditis or myocarditis. And we know nowadays that this risk is extremely low. It's lower than 1%. Okay. On the other hand, if someone gets caught COVID infection, the risk of having myocarditis is at least 90 times greater than if they did not have the COVID infection. Okay, we know that the risk of myocarditis is also greater among those who had or have COVID and are men greater than 50 years old. Okay. A reminder about myocarditis after the vaccine. It's more common among those who are very young, like in their younger than 24 or even teenagers. But again, the risk is very low. It's lower than 1%. And even if someone has that, all the studies have showed that usually it's a benign condition that people don't require hospitalization, and when it's needed, they have fully recovered after that.
That's great. Thank you.
Looks like we're not seeing any more questions there, Marissa.
Yeah.
We're just that good. We got them all answered.
Good. Okay.
What about indoor exercise versus outdoor exercise in the winter in terms of fresh air? Well, let me see. So I'll throw my 2 cents and then we'll ask Carolina just in terms of fresh air, in terms of infection and stuff like that. So depends really on the facility that you're going into. All right. So we know that in the winter and in the summer, especially for shopping malls and stuff like that, big facilities, um, it's hard for them to heat and humidify or dehumidify the air and stuff like that. So a lot of them will actually recirculate their air inside. So the air quality arguably would be a little bit less. But I mean, you try walking downtown Toronto on an August day, I don't know, like that, I don't think that's exactly fresh air either. I don't think there's a really, really significant difference from a physiological point of view. Carolina, do you have any thoughts at all from an infection point of view, walking inside or outside as far as COVID, flu viruses, and that kind of good stuff?
Yeah, this is a very important point that I did not mention. But there are many institutions, I would say, including the CDC in the US, that is recommending for those, especially at a higher risk, to consider wearing a mask when in these environments where we know that there will be too many people together breathing the same air. So if possible, I would say if it's something that you are comfortable with, it's something that I would suggest, yes. Then you will be, especially if you are in a closed environment, you'll be protecting yourself from not only COVID, but also influenza and other infections.
Great. Thanks, Carolina. So let me see. One other question that we see up there real quick. Is there any information about hiking at elevation in cardiac college with heart diseases? John Muir Trail, cold in the summer with thin air. I think the cold is going to apply everywhere, and we do have information on the website about the cold air. Exercising at altitude, though. Carolina, you want to talk a little bit about exercising at altitude?
Yeah, it's a good question. So usually, let's say healthy people, we all need, healthy or not, I would say, some time to adjust our body to the high elevation. So basically, the oxygen, think that the oxygen at the level that we are is more abundant than compared to those high, very high places. So if your body is not adjusted, you may feel shortness of breath. And when you are exercising, you feel even sometimes not only shortness of breath, having to stop exercising because you cannot catch up with the same, keep up with the same pace, but also sometimes dizziness, headaches, and things like this. So I myself said, no, years ago, I'm young, I'm okay, this is not important. And here we go. I'm not wearing those 3 hours of adjustment, I will walk. And I was really out of breath. So let's respect that, especially if someone has a cardiac condition. I saw people having to run and ask for oxygen supplement in the hotel because of this. So I would say adjusting to the place. If you have a cardiac condition, probably hours are not enough. You may need more. And then you can start exercising slowly, learning your new limits, and then progress from there. I think that's the short answer.
Perfect, Carolina. I think we're going to have one last one. It's a good question that I think this will be our last question for the evening, and comes from my buddy Gabe. So Gabe had his flu shot or his COVID shots, but now that there's the new COVID shot, he's saying, do I still need to wait for the 6 months to go by, or should I rush out and get the latest COVID shots, knowing that it's covering more variants than my old one? How do you feel about that one, Carolina?
Yeah, so the recommendation coming from our government, Ontario Health, etc., is that if you had your COVID shot more than 6 months ago, then yes, you should go and as soon as possible take the new shot. Okay, for that reason, because there are new strains that the old shot was not covering. Okay, they at this point are recommending us to wait 6 months, 6 months from our last shot. Okay, so if you're not 6 months from that day, you should probably wait a little bit, talk to your family physician. I don't know if they can have exceptions, but think that your body still have some protection for sure from the vaccine. So it's the same mindset if you had a recent infection. Okay, so for now, that's what it is, 6 months.
That is great, Carolina. And I think on that note, folks, we're going to wrap things up. Thank you, everyone, for joining us for our session. We're going to continue to try and do these on a fairly regular basis. So look for another email from Marissa, who's leading the charge for the grad group. She's going to reach out to some of our colleagues and see if we can come up with another session. And just to kind of help Marissa out with that kind of thing, if there's any topics that you guys would like to hear us speak about, please feel free to reply to the Heart Health for Life emails that you get and send in some thoughts and some suggestions. I'm not going to promise that if you send in a topic, we're going to talk about it right away, but we do appreciate hearing what you guys would like to hear, because that's why we're here. We're here for you guys. We want to talk about the stuff you want to hear about. So please let us know, and we'll do our best to accommodate as we can. All right. On behalf of Carolina and Marissa, thank everybody for attending.
Thank you so much.
You.